Hi everyone, this is Marva Riley. I want to talk with you a little bit about a drug that is the most commonly prescribed drug in the United States and probably around the world. It's called atorvastatin. The brand name is called Lipitor. Several years ago, a very close family member of mine, at about the age of 40 to 42, developed hypertension, was diagnosed with high cholesterol, diagnosed with diabetes and thyroid problems. Now, it is about that time that many people who do not take care of themselves start seeing these health issues pop up. Didn't pop up by accident, it's because they just weren't taking care of themselves. So this family member went to get a checkup. The wife forced him, and the doctor said, "Yeah, you're diabetic," and his mom was diabetic, so they like to say it's genetic, and he had severe thyroid issues, hyperthyroidism, where it lost a lot of weight, and the cholesterol was high, and the blood pressure was high. So they did what the doctors do, and they started prescribing all these drugs. They prescribed metformin, which is poison, which is linked to cancer, among so many other things. I believe they've since then pulled metformin off the market. I think so. And they prescribed Lipitor, and an antihypertensive drug and thyroid medicine. Was about 40, 42 at that time. This person was overweight, didn't eat properly, and didn't have any exercise routine of any kind. Very shortly after they prescribed the Lipitor, he started having severe muscle pain in the thighs, in the butt, in the calves, a severe muscle pain, joint pain, and weakness, muscle weakness and overall weakness, even some confusion and stuff. It was just a mess for a young man. So they did not take him off the Lipitor, even though his liver function test kept going up and up and up, and it was clearly destroying his liver. They didn't take him off it. They kept switching him from one statin to the other, one statin to the other. Eventually, there's a physician that I knew that was a kidney specialist, and he had gone also into holistic alternative medicine, along with his regular, renal practice, and asked me if I could take this family member in, and he said, yeah. And when I went, he said, Marva, he said, the cholesterol, the thyroid, the diabetes, and high blood pressure, it all goes hand in hand, and this is a lifestyle. These are lifestyle problems. He needs to change his diet and start doing some exercise, lose the weight, etc. And he took him off the cholesterol drug completely. He said, sir, you should never take cholesterol drugs because it's destroying your liver. He drew some liver function tests. All his liver enzymes were very high, higher than even when his primary doctor had done the test. It was destroying his liver. So the physician took him off it, put him, prescribed a healthy diet for him, which he was following for a while. That didn't last. And even though his blood tests were doing better, he went back to eating poorly, and all the diagnostic tests, the sugar kept going up. He went on insulin. The cholesterol kept going up, even though the regular doctor had put him back on statin, and the blood pressure just wouldn't normalize, because he continued to live his lifestyle the way he always lived his lifestyle. And I remember years before that, I had a patient who told me that her husband died of liver failure because of statin. He was on cholesterol lowering drugs and it destroyed his liver. He went into liver failure and he died. Now, I'm not telling anyone not to take their cholesterol drug, but you ought to at least know what the side effects are for these drugs that you're taking. You ought to know that. And I wanted to read, I pulled up an article written by the Mayo Clinic because I wanted to read them to you, because a lot of people, you know, when you go to the pharmacy to fill your prescription, the pharmacy normally gives you a printout with the side effects for the medications that your doctor prescribes, because the doctor usually doesn't discuss these things. Sometimes I think these doctors don't know, because my family member was having muscle pain and joint pain and back pain, dark urine, confusion, and yet they kept him on the statins. They felt that having him on the statin was more important than the fact that the statin was destroying his liver, and if his liver was destroyed, he would die. So the Mayo Clinic says the most common side effects of atorvastatin or Lipitor are headache, hoarseness, lower back or side pain, pain or tenderness around the eyes and the cheekbones, painful and difficult urination, and stuffy or runny nose. Well, how many times do people have headache and they reach for ibuprofen instead of drinking water, which could be because they're dehydrated or could be a result of these drugs that they're taking? Or they have back pain and they reach for ibuprofen or Tylenol, as opposed to wondering if it could be the result of the drug that you're on. The Mayo Clinic says the less common side effects are back pain, belching, and excessive gas, constipation, general feeling of discomfort or illness. That family member never had any energy, always felt sick even though he was a young person. Heartburn, indigestion, or stomach discomfort. Now, when folks experience that, they reach for Tums or something like that, that innocent over-the-counter drug, which sucks calcium from your bone and really has so many bad side effects themselves that we really shouldn't be taking them. Less common side effect, lack or loss of strength. My family member had that. Loss of appetite, nausea, shivering, stomach pain, sweating, trouble sleeping, vomiting. Black tarry stools, because the liver is being destroyed and the liver is responsible for the clotting. And so if your liver is not working properly, you could have blood in your stool, bloody nose, bloody urine or cloudy urine, blurred vision, difficult burning or painful urination, difficulty seeing at night, excessive muscle tone or tension, increased body movements, increased sensitivity to the light, increased thirst, mental depression, nervousness. How many people walk around depressed, nervous and anxious, and they prescribe anti-anxiety drugs instead of looking at the side effects of these medications that they have these patients on? So you've got to be your own advocate, my friends. You got to know why you're taking the drugs that you're taking. What is it for? What does it do? What are the side effects? And you ask your doctor, what can I do to reverse the condition so I can get off these drugs that can potentially destroy my body and even lead to death? You've got to be your own advocate. Many people are taking 4, 5, 6, 10, 20 drugs in a Ziploc bag. You don't know what drugs you're taking. You don't know what they're for. You don't know what the side effects are. And you don't even know, of course, the interactions that these drugs might be having. And a lot of the health issues that you're having, the headaches, the back pain, the urinary issues, the impotence, all those issues could be a result of polypharmacy, taking so many drugs, and or the side effects of 1 or 2 or 3 of these medications. And a lot of people are walking around taking a ton of drugs, a ton of medications, They don't know what they're for, and they don't know what their side effects are. The least you can do is be an informed patient, an informed client, an informed person. So at least if you decide to take these drugs, at least you know what the risks are and why you're taking it, etc. It's the least that you can do for yourself, for your body, and for your loved ones. Every drug has negative side effects. Every single one of them. Healthy lifestyle works. Like eating fiber-rich foods, like old-fashioned oatmeal, steel-cut oatmeal. Top it with some flax, chia, hemp seeds, and some pumpkin seeds, for example, some nuts, and grains, roots, vegetables. Every day you should be having vegetables and fruits. When you eat fiber-rich foods, that food helps to lower your cholesterol naturally without taking drugs. So those are some things that you need to be aware of. And you also need to be aware of that cholesterol drugs really do not lower your cholesterol. I've known so many people that are on cholesterol drugs because their doctor put them on it, and it has done nothing to lower their cholesterol. I had a nurse manager some years ago who told me she was on cholesterol drug because her doctor told her to, but it had not lowered her cholesterol one bit, and she had been on it for 7 years. Well, you think after 7 years you start consider, what else can I do to lower my cholesterol? Eat more fiber-rich foods, and fiber-rich foods are plant-based foods. Meat does not have fiber. So every day, eat a raw salad, eat some steamed vegetable, eat some grains, eat some nuts, eat roots, fruits, and oatmeal is a good an oatmeal bowl every morning instead of that bacon and egg and sausage, which drives up your cholesterol, is a good idea to get that fiber in your diet and reduce your cholesterol naturally without being on drugs that have so many negative side effects. Okay? I hope this helps you. This is Marva Riley. If you like this content, I invite you to please like, subscribe, and share with your friends and family who could benefit from this information. Don't forget to hit the subscribe button and leave a comment. I'd love to hear from you. Thank you so much.